This is wet to dry dressing change. Prior to doing this, we want to make sure that our patient has had pain medication, and if they haven't, then we want to administer it so it gives time for the medication to start working. So we've already verified that this patient does need a dressing change, that it's in the MAR, that it's the right patient. So we're going to go ahead and set up the equipment on an overbed table or a surface within reach. And then we're going to assist the patient to a comfortable position that provides easy access to the wound area. Next, we're going to check position of drains, tubes that may interfere with removing the dressing. And we're going to put on clean gloves and use the push-pull method to remove the old dressing. This is going to prevent skin breakdown in the healthy skin. So we're going to carefully remove that soiled dressing and place it in the trash can. It's important to note the amount of drainage, if there is any present, the type, the color, or odor. Now we're going to perform hand hygiene, inspect the wound, and we're going to do the size, appearance, and drainage. And now using sterile technique, prepare a sterile work area and open the needed supplies. Open the sterile cleaning solution and verify that it's not expired, and we're going to lip it into the sink and then pour it into a sterile basin. Now we can put on sterile gloves and clean the wound. So to clean the wound, we're going to use saturated gauze and saline, and for sterile technique, we're going to clean from top to bottom, starting with the center and then moving to the outsides. And we're going to use a clean gauze every wipe. So wipe and then throw away. Next, we're going to do the same method for drying the wound. So we're going to use dry gauze and pat down the wound till it's dry, first starting with the center of the wound and then moving to each side and throwing away each gauze after each section of the wound is dried. Then we can remove our gloves and place in the trash can and perform hand hygiene. And now we're going to put on a new pair of sterile gloves. Now, if the wound is deep, we want to make sure that we pack it with a wet gauze. As shown in the video, you want to weave it in your hand and then use a Q-tip to pack it into the wound. This promotes healing, especially for deeper wounds. And then we want to apply any ointments included in the MAR and apply a skin protectant barrier to the surrounding skin prior to putting on the top dressing. So now we can put on a dry gauze on top of the packed wound, apply the abdominal binder and tape, and then make sure that you date, time, and initial the dressing. Remove PPE and perform hand hygiene. It's also important to check all wound dressings at least every shift, and more frequent checks are needed if the wound is more complex or the dressing becomes saturated quickly.